Welcome to the Holistic Truth Podcast. I'm Jamie Dorley, CEO of Nutritional Frontiers.
And I'm Kristine Genovese, creator of the Soul Intelligence Method. We're here to help you break through chronic disease and dysfunction physically, mentally, emotionally, and energetically.
With real proven strategies, protocols, and tools you can use in your practice today. Welcome back to another edition of Holistic Truth. I am Jamie Dorley, CEO of Nutritional Frontiers, with my partner in crime, the one and only
Kristine Genovese, the creator of the Soul Intelligence Method. And today we're going to touch on one of our 12 wellness solutions, bone, joint, and inflammation.
Well, not only one of them, the original one, and I know this one really applies to you as a competitive athlete and tennis player. So let's jump right in, Kristine. This is really exciting.
Awesome.
You know, one of the key things, when you look at osteoporosis, right? We try to improve mobility, joint pain. Really the goal is to help prevent, of course, manage any injuries, any fractures, any muscles, and then we're going to help try and rebuild all these things together. So, interesting fact about osteoporosis: 1 in 2 females will suffer an osteoporotic-related fracture in their lifetime, and now it's 1 in 6 males. So it's not.
And do you want to know why from an energetic perspective, Jamie?
I would love to hear it, Kristine.
Osteoporosis occurs when you're feeling weak, unsupported, or limited, like holding on to guilt or resentment. So, perhaps that's one of the reasons why when you get to that age, you're not willing to take responsibility. There's a lot of self-neglect, and you could be carrying a heavy burden for others, or maybe even feeling lost or disempowered.
Yeah, and there's 2 types of osteoporosis, right? There's the they call it senile. That's where you age, and it's a slow bone loss over many, many years. So we've seen relatives and loved ones, 80, 90 years old. They get the hump in the back. The old thing used to be, oh, they fell and fractured their hip. Now they're saying the hip fractured, then they fell. And we understand that one. The one that's more concerning is the menopausal osteoporosis. I just had a client call me. She says, I'm losing bone rapidly, and she's only in her 50s. Those are a lot harder. The challenge there is more hormonal related.
Yeah, and that's really when it's, especially for women, like feeling lost or disempowered, isolated, ashamed, almost like your world's falling apart, and a lot of it has to do with having difficulty speaking up and asking for what you need. And when I think about this, I think about one of my relatives that I know you know pretty well, James.
Yes. And it really hits home, right? When you hear those situations occurring. So we do have some great solutions for you. That's the good news. And in fact, when I first got into wellness as a American College of Sports Medicine certified personal trainer, a lot of my clients, interesting enough at the time, were like 40 to 60-year-old females. And the number one reason they hired me was that they had seen a relative suffer from osteoporosis and they didn't want to go through that. So the best thing you can do is prevention, and the bone needs a stimulus to grow. And one of the best things you do is exercise. I know you're state champ in tennis. I know you've been doing the weights lately. I've always worked out. I'm doing Pilates and weights, but you need to give the bone and the muscle and the joint a stimulus so that it grows stronger and more complete. About half a bone is minerals, but you have these other growth factors in there too. So it's the stimulus of the exercise and the training, the tennis playing, whatever it may be, that will give the bone a reason to remodel.
Okay. So I see that there are a lot of key factors that, affect osteoporosis, like diet and movement. And I know 3 things that we really focus on are the calcium, vitamin D, and vitamin K2.
Yeah, the old school was just calcium, but the doctors were recommending 1,500 milligrams of calcium carbonate. That does not get in the bone. And what would happen? You get calcification in the blood. So heart disease that used to belong mostly to men. I wonder why that is. We can look that up later. But now it's actually it's affected females too. And the reason is calcification in the blood. So diet, get off dairy products. Broccoli has more usable calcium than a cup of milk. So number 1, get off dairy products. Get off sugars and processed food. You want to eat real foods. Second, you got to give the stimulus to the bone to grow, and then the right nutrients. It's not just calcium. You need vitamin K2 to go around and clean up the calcium and drive it into the bone. So this is more of a K2 issue than actual calcium issue.
Awesome.
And when you look at it overall with mobility, osteoarthritis comes into play for this too. You got rheumatoid, you got osteoarthritis, you got joint degeneration. So what's going on here is that the joint is inflamed and you have a breakdown of tissue over a long period of time. Have you suffered from any, joint issues with all your years of tennis?
Why, yes, I have. I have a hip. I actually have an artificial hip that was on my right side, and I've been having hip issues on my left side, which is kind of freaking me out since I don't have to have any other surgeries. But yeah, definitely. I know, it's a common reason for total hip and knee replacement surgery, right, is osteoarthritis.
Yeah, and you got to give the nutrients for the body to rebuild. So if it's to the bone, the connective tissue, the ligaments and tendons, or it's actually for the cushion, the cartilage on top of the bone. So, someone, for example, with knee pain, and they go to the doctor, and the doctor says, "Oh, you have bone on bone," but it's partially true. When you look at joints overall, if it was completely bone on bone, you wouldn't be able to stand. But it acts as a shock absorber, just like you have with your car. And you got to rebuild that cartilage in there so that you can take the pounding when you're going up or down stairs, when you're running or walking, if you're moving or lifting things. So one of the key things to do is to give the nutrients such as hyaluronic acid, glucosamine, MSM. They all build up these shock absorbers. And now think of an ankle, a smaller joint, or a wrist. But when you get to the knees, and then think about the hip. So if someone is having an issue with their hip, we need to go higher doses and give it more time to rebuild these. But a lot of joint pain occurs because you have a breakdown in the tissue and that the arthritis is set in. However, you can help this. In fact, we had one of our clients, Dr. Ray Vactor, a chiropractor. He tore a meniscus in his knee, and we put him on HA plus. First month, not a lot of relief. Second month, not. About halfway through the third, he called me and says, "Can this be working?" Now here we are. I know. I'm like, I don't know. You tell me, doc. And then here we are. It's at least 7 years or 8 years, maybe longer, and he still has not had to have surgery on the meniscus. So think of prevention as the key. Diet plays a huge role in this, and so does nutrients. So you got to have a program that addresses all those aspects.
Well, generally, when we're talking about joints, we're talking about flexibility or rather inflexibility, right? With knees, it's like control or blame or judgment, anger, resentment, frustration, like all of those kinds of things. And it depends on which knee it is. The right tends to be the right side of the body tends to be the male side, and the left side tends to be the female side. So it can really it's really kind of interesting when you start diving into it. Whereas hips in particular are more about just family problems or disagreements, maybe feeling like unappreciated, used, angry, betrayed, deceived, let down, shot down. So it depends on which area of the body we're talking about that's having the joint issue.
This is fascinating. You think my knees would be shot after hearing that statement, but they're pretty good. I always want to be taller, but I do have one advantage of being a little shorter is that my joints are pretty strong and stable. This is really interesting because, if you look at the medical approach, right? NSAIDs, nonsteroidal anti-inflammatory drugs, these are miracle drugs, but they were designed to be used for 24 to 48 hours. The new selective COX-2 inhibitors like Celebrex and Vioxx, they only release half the research for about 6 months. Because here's what happened with the NSAIDs. There are some of these COX enzymes that in certain tissue, they're repair mechanisms, like in the gut. So if you take NSAIDs chronically, you're at high risk for GI issues,
Mm.
liver, kidney, and then, a lot of people have hospitalizations and even deaths. So there are over 100,000 hospitalizations per year from NSAID use, chronically use NSAIDs. And they found from the surveys, Christine, is that the users are chronic users and heavy users, right? and not a good strategy long term. I remember years ago when my son was in high school, the one kid on the football team, he hurt his shoulder. He was a senior. They had a chance for the championship that year. He was taking the Proxen to leave by the handfuls, and his parents found him in the kitchen. True story, laying down. He had stomach bleeding.
Oh my
So
gosh.
this is a real big issue, folks. We have solutions that you can use from nutritional frontiers like SPM, X Flame, Green Lip Muscle, Inflam that will help you. So when you look at it first, let's look at what do we do to rebuild the bone. We have the Super Cal Plus, one of our first formulas ever. Now we do use a certain type of calcium, MCHC, microcrystalline hydroxyapatite compound. These are from cattle from New Zealand, and the MCHC is live bone food. There's actually protein growth factors in there that are live, and elemental calcium. In addition, we use things like magnesium bisglycinate in a 2-to-1 ratio, and we're using the K2, but the right type of K2 because most K2s on the market are unstable. So we use a patented research trademark version called Vita MK7. Our partners were just down here last week. So really exciting. Super Cal Plus. This will rebuild any of the bones and give you all the mineral support you need. You can use one for prevention, 2 to 3 if you have osteopenia, which is bone loss, and then osteoporosis, you need 4. Osteoporosis is actual holes in the bone. In addition, we have a Super K2 Plus. I like this because it gives me the vitamin D I need every day, gives me the K2, and also the support nutrients. So we have a couple different options with you. Vitamin A, K2, and D are very deficient. So that's why we put these two together to get a higher dose. The K2 will actually drive the calcium inside the bone.
Awesome. Well, this is one of my favorites, HA plus.
Uh-oh, why is it your favorite? I thought
Because
I
it
was your favorite. Now HA plus?
yes,
I've been
collagen
replaced.
is in it. The collagen that we have in it, the BioCell collagen, because not only does it help lubricate the joints, but it also helps with those fine lines and wrinkles.
You don't have any fine lines or you want to talk about wrinkles.
This
Maybe
is
I do.
why.
Well, HA Plus got a great story. We hear about collagen all day long these days, right? We've had HA Plus before Nutritional Frontiers. Dr. James Weiner, one of the co-founders, he actually had HA Plus in his own label. And why we do HA Plus with the BioCell collagen? Because hyaluronic acid is a very big molecular weight. It's hard to absorb orally. So, what have people done over the years when they go to a doctor? They get injections or creams. However, very expensive and very painful. So, BioCell, in actually 2004 at a Newport Beach, California, launched their really groundbreaking study that was published in JAMA, and it shows the data here in the next couple slides. But what they did is they reduced the molecular weight to 1/600th. So it absorbs orally. It actually gets into the bloodstream in 4 hours. It
Mhm.
peaks in the blood in about 12 hours. So we get it in the blood. Now, the part two of the study is that can we get it into the joint? And they found that they actually drive it into the joint. The metabolites are there 1/600th the size, and it not only gets in the joint, but it stays there for 28 days. That's why with Dr. Ray with the meniscus tear, it took some time to build up to where you start feeling the benefit. My dad uses it. You met my dad, 85 years old.
Mhm.
He's had a bad knee since high school. He got an injury, and he swears by the HA plus, and he takes it every day. And he's still golfing and bowling and doing all kinds of activities. And this is a steady state, results on this. So the cool thing about the BioCell, it's got type 1, 2, and 3 collagen. It also has hyaluronic acid and naturally occurring chondroitin sulfate. So it's a matrix of nutrients. That's why we use the PRT. And this actually shows the difference in the absorbability of the BioCell versus regular collagen. Much more bioavailable.
So we've got the X Flame coming up next.
Yeah, so the HA plus will rebuild, but sometimes if you have a fire, God forbid, in your kitchen, you need to cool down the fire first. So we have two PRTs in here. You familiar with DMG?
I am familiar with Darn Mighty Good. Yeah.
DMG, dimethylglycine, otherwise known as darn mighty good. three U.S. patents, one for OA, using that with the green lip, another one for RA, rheumatoid arthritis, systemic inflammation. So a lot of great research on that. We use some other support herbs that people are familiar with, like boswellia and turmeric and cayenne pepper. So this is a formula that we've incorporated with the creselazine. Um, and if you look at esterified fatty acids, they're really potent anti-inflammatories. This formula has been around for over 10 years with incredible research and results. Now, the Inflam, we took a little different approach. Some doctors want a completely herbal blend, and that's where you get here with the Inflam. So, a slightly different approach. This has the curcumin. You familiar with the curcumin?
I am.
It is
That's our turmeric extract.
Yeah, and it's 46% more bioavailable than generic turmeric. It's actually been studied on U.S. patients. The only curcumin that's actually been studied on U.S. Usually they're studied on people from India, which have a high. The diet has really got a tremendous amount of curcumin in it. So greatest studies on that. Curcumin, fantastic. We have it as a standalone, plus in the Inflam. So either use Inflam or X-Flame to cool it down, and then use the HA plus. Which one do you like?
I like HA plus with our X Flame. That's my go-to combo. And then, of course, for helping to lower chronic inflammation, our SPMs.
And how many of HA plus do you take a day?
Usually it's 2 HA, 2 X Flame, and 2 SPMs. Kind of keep it
And I
real.
know you're a humble girl, but state champ in tennis. You've been playing 3.5 level up to 4 level. She plays in the female really competitive league, and they have the mixed double league, and she's really been doing fantastic down there. And you've been able to move around the court. This is after you've had some joint issues in the past, so you're a walking testament of how important these nutrients are. So, creselazine, another one with a double-blind, placebo-controlled study. U.S. patents on this. Go to the next slide. Actually, it's really interesting. Is that they compared this, Christine, versus NSAIDs. So
Okay.
NSAIDs are like Advil or Aleve, those type of things. And the people on just the creselazine had 100% reduction in ankle and foot pain. You know anyone with any ankle pain?
Well, I did roll my left ankle about, I don't know, I think we're getting about 8 weeks ago. And I really had a lot of pain with it. I was very surprised. I had a lot of inflammation. So I definitely used my trifecta, which is the SPMs, the X Flame, and the HA plus. But I also started to take a couple other things to help, right? I looked at an enzyme like or Cybezyme to kind of get all the debris out. And I also use green lip mussel to also help me. And that helped me recover, I think, a lot quicker and got me back on the court within about, 5 weeks of doing it. And when I looked at what is my left ankle, what was that all about? And it was difficulty listening to my own counsel, like not paying enough attention to me. Belief that I, had to be a slave to um, others, whether that be my partner or my work, and not spending enough time nurturing myself and discovering what was important to me. So I got a divine timeout to help me heal.
You sure did, and I tell you what, it was powerful. Everyone felt it. So we're glad you're getting back to 100%. So this ingredient, creselazine for ankle and foot pain, 80% for neck, shoulder, elbow, wrist, and hand, and even 70% in knee pain. That's just on that one ingredient. You get the synergy of all the nutrients. And I love hearing your story, Christine, is that you can take these and create your own protocols, right?
hmm
Depending on what the issue is right there. And here's some of the testimonials. You want to highlight some of these for the people?
Sure. I mean, we've heard from people saying, that it works so well that they didn't even notice the pain. It only took 3 or 4 days, to kick in. That was someone that had back and knee pain. Certainly, somebody else had talked about how they felt it worked better than any actual drug they've used for like bilateral arthritis and swelling in their knees. And the another person who had shoulder pain also endorsed this ingredient. So Jamie, why don't you remind everybody again where they can find the creselazine? What product is it in?
The Crecelsian is actually in the X-Flame.
Awesome.
We've utilized it by itself with 288 patients initially about, 17 years ago. Down at the old pain release clinic. But the way I like to position these is one is if we need help more with bones, right? Let's look
Mhm.
at the Super Cal Plus and the Super K2 Plus. If we're looking at more joint health, let's cool it down with the X Flame and Inflam, and then let's rebuild it with the HA Plus. The great thing about the HA Plus is that you get some positive side effects on that because you had mentioned wrinkles and skin.
Mhm.
Half the research on the BioCell is for skin. And what they found is that it can hold about 10 times the hydration level. So when the skin's dehydrated, like you see a smoker, their skin's really bad. The HA Plus will actually bring hydration in there, bring water in there, and the collagen is a building block to healing that tissue. So great for joints, hair, skin, and nails.
Well, Jamie, if people want to learn more about our bone, joint, and inflammation wellness solution, where should they go?
They should go to nutritionalfrontiers.com, go to the catalog section. We have all of our wellness solutions and booklets. And also, if you're a healthcare professional or a staff at an office or a manager, if you're a client or not, contact us directly at Nutritional Frontiers. One is that we can do Zoom trainings depending on where you're located. And in addition, we may have a outside field support person that can come to your office. Or if you're really cool, me and Christine may fly in to meet with you.
Well, I hope everybody, joins us in helping to make the world healthy physically, mentally, emotionally, spiritually, energetically, in all ways. Until next time, we'll talk to you again on The Holistic Truth.
Thanks, everybody. Have a great month. Thanks for tuning in to the Holistic Truth Podcast.
If this episode spoke to you, please follow the show and share it with someone ready to take charge of their well-being. And if you can, leave us a review. It helps others find our podcast.
For more tools and practitioner support, visit nutritionalfrontiers.com.